Thank you. I'm Michael Strauss. I'm a physician. I'm a practicing physician. I'll tell you who I am. I received my medical education in Belgium and Brussels. I came back to New York and I worked as a physician for, and I usually do a lot of this, when I say 40 years, it's a long time. And I worked also at the end of that 40-year span. I became the chief medical officer of one of the Mount Sinai facilities, New York Eye and Ear Infirmary on 14th Street in Manhattan. And yeah, I'm quite proud of that. It was 5 years. The big job was trying to make less mistakes, and I learned how to navigate. I learned how to deal with an organization where processes had to be re-examined all the time, especially if they went wrong. And it was very rewarding. I learned a lot. I worked with the leadership of the Mount Sinai medical system. I was in constant collaboration with the chief executive officer of the whole system. I learned a lot there. And I left New York Eye and Ear Infirmary after doing that for 5 years. I left it in good hands. And I went down the avenue, 14th Street, 2nd Avenue. I went down to 2nd Avenue and 3rd Street, just east of the Bowery. And I started to work in a homeless shelter where I was providing medical care to residents in the facility. These were men who were marginalized and who had basically no place to sleep and no place to eat. And we took them into a wonderful organization called Project Renewal, where we provided medical care and psychiatric care, job training, addiction services, and we tried to bring people in from the margins. And I think we are on a righteous path doing that kind of work. In 2020, my wife and I moved to Putnam Valley, where we live now. And when I was leaving the homeless shelter, they asked me, what are they going to do? How are they going to replace me? I'm leaving on short notice. And we decided that I would practice medicine there via video until they can find someone to replace me. I'm still practicing medicine there by video, and they're still trying to replace me. When I came to Putnam Valley, I found myself with a little extra time on my hands, so I became an EMT, and I am working in the Putnam Valley Volunteer Ambulance Corps once a week. And thank you. So that's who I am. Why do I want to do this job? Why? I finally figured that out. I knew I wanted to do it when I said yes. That was, so this is an opportunity. The coroner's office, you think of it in terms of morbid things, end stages of life, death. And the reality is that the coroner's office determines the causes of death of people in the county, and there's criteria: death when the circumstances are suspicious, death when there's no attendance, death when whenever anyone thinks there's something unknown or wrong, the death is investigated by the coroners, and they pronounce the cause of death. And what they don't do is they don't really try to understand why that cause of death was present. Someone died of diabetes. Well, why did they die of diabetes? What led them to die of diabetes? They died from suicide. Why? Why did the healthcare system, the psychiatric support systems that we're supposed to have in place, why didn't that work? They died of an overdose. Well, why is it? And what can we do about it? The coroner's office doesn't ask those questions traditionally. They cut and paste and stamp, and they do that. It's legally required, and they do what they have to do. But there's so much more that they could be doing. There's so much more that can be learned from the work that they do, the information that they gather while they're making their investigations. We could take that information and bring it back into the system and make the system better, make it better for everybody, take what's learned at every point in the process of taking care of people and make the whole thing better all the time. It's continuous quality improvement. I think there's a potential for the coroner's office to function in an important way in that regard, especially if, for instance, the coroner and the county executive are like-minded members of the community. And the nice part of everything is what I just said is all true. It's all realizable. It can be achieved, and I'm inspired. I think we could do it. And thank you.